Most likely you will come across nursing reflections when you are either on firstly clinical placements or even at university. So that's basically how I do my reflections. Your reflection is the basis of the knowledge that you have obtained on either of the clinical placements or academic. Hi guys, welcome back to my channel. I hope you're all doing well. Thank you so much for joining me once again back onto my channel. My name is Belinda, and if you've not already subscribed, please don't forget to press the subscribe button as well as turn the notification bell so you get a notification every time I upload. This is a nursing based channel, all things nursing, as well as other bits and pieces as well. Okay, so as you read from the title of this video guys, today I'm doing another nursing video, and today I'm basically going to be doing a video based on a nursing reflections. So nursing reflections is something that you might come across, not you might, most likely you will come across nursing reflections when you are either on firstly clinical placements or even at university. One of the two things that they like to do is give students nursing reflections to do on clinical placements, basically reflecting on what you have learned throughout the placement. And also these nursing reflections normally help you get signed off with your learning outcomes. Okay. So basically the reflection is just to show your practice assessor or your personal tutor or your mentor, whichever one you want to call them, to see that you have gained some sort of knowledge, to see whether you are adequate enough to be qualified, you know, because at the end of the day there's no point in going to school, doing academic work as well as especially clinic work, and you don't learn anything. So your reflection is the basis of the knowledge that you have obtained on either of the clinical placements or academic purpose. So as you guys know, I am currently in my last week of clinical placements, and I am in my third year undergoing my first placement prior to going into my management placement. At this point in time, I just completed my 11th week. Okay, so I've got one more week to go before I meet with my placement assessor to obviously sign me off to say that, you know, I've passed my placement and I can go ahead into the next placement. So basically what I'm doing at this point in time guys, I am doing my reflections. While I was actually typing these reflections out, I just thought, you know what, it will be an interesting video to make, obviously showing you guys how the whole reflection shaboong looks like. So I thought, let me come up here and do some sort of reflections for you guys so you guys can have some sort of idea what I'm talking about. So I've done a couple of other reflections, so depending on how many learning outcomes you have to achieve. In year one, I think we had about 18 learning outcomes. Year two, they doubled, and at this point in time we've got 44 learning outcomes that we have to achieve. So normally they would say that you have to write 1 reflections for 1 week you've been there. I don't know who says that, but depending on your practice assessor, obviously this is a discussion that you would want to have with them prior to you obviously completing your placements. So with my placement assessor, she's not too fussed. You know, sometimes you get those people who are really extra, and then you get those who are quite chilled and okay with it. So I remember when I first started first year of nursing, I was really panicking about all of these learning outcomes. But sometimes with the learning outcomes, they are quite repetitive, if you know what I'm saying. So it says the same things in different words. So you really have to be very, very, you know, careful. Not careful in the extent that, oh, you're going to repeat yourself. No. Careful in regards to how you place your learning outcomes. Sometimes you can place quite a number of learning outcomes. I mean, like for me, for example, I've already done 3 reflections, and it's crazy because in my first year I had 18 learning outcomes, but I did about 7 reflections. Okay, and then now I've been able to basically minimize my reflections from 7 to 4, and I've got 44 learning outcomes. So you just have to see how it works. Anyway, so let me stop talking and bring out the reflection templates for you guys. So I saved them under reflection. So this is how the reflection template will look like. Okay, so your reflection template will normally come up like this. So you have your date, you have your placement, obviously where your placement is on. I'm gonna say ward 15. Obviously I'm not going to disclose which place, but yeah, I'm on ward 15 in some hospital. In addition to that, that will be my reflection number 4, because I already know that I have written 3, so this is my 4. My mentor's name, I'll leave that blank for now because for confidentiality reasons, and date and that. Okay, so this, you have to describe what happened. So you can describe a certain day about what happened. That's why, again guys, I've been telling you guys about the importance of carrying a notebook when you're on clinical placement, so that you can go back when it's time to write your reflections and remember everything that happened on that specific day. In addition to that, you talk about what were you thinking or what were you feeling. So what were your thoughts at that time? What were you feeling at that time when that certain situation or whatever happened, okay? In addition to that, you have to evaluate. So you have to do an evaluation whether it was a good or bad learning experience. Now, in my thoughts, there is never any bad learning experience. I think all your experiences on training are good learning experiences, whether you did something wrong or you didn't, because at the end of the day, if you messed up, it's a learning opportunity for you to grow and not do it again. So in my opinion, when I do the evaluation, I always make sure that I obviously include good experiences. So what sense can you make of the situation? So what have you learned from the situation? What is your understanding of the situation? Okay, what else could you have done? You can say what you have done. If you feel like it's not applicable, put there not applicable, because once again guys, with being a student nurse, obviously you are limited to what you can do or what work you can carry out. So you would include that. Action plan, I would normally leave that blank, like I said, because if I messed up, okay, I would put there an action plan. If I didn't, I would leave it open. So in regards to action plan, in my other let me see if I can find it. So in my other reflection, I think I did do an action plan. So basically action plan, actually now I'm talking to you guys, action plan in this case for me would be to delegate tasks to various staff if the same situation arose again. So this basically, let me see where am I. Okay, so can you guys see basically how many learning outcomes I have basically included for this reflection? Quite a number of learning outcomes just from that small reflection. So on this specific day, I had a flip day. So a flip day stands for facilitated learning in practice. So basically what they do is they assign you your own patients and you are in charge of those patients with limited supervision. So there will be a nurse with you, but she will be only with you when you are doing your medication, and she won't be standing over you, she will be standing afar. So basically you are almost like doing it independently, you know, just for her to monitor. Now on this specific day, she had no issues with how I've been doing the whole flip day. However, she did have an issue with me unable to delegate. Now for me, that was a bit of an issue, delegating, because she wanted me to tell her what I wanted her to do, if that makes any sense. Okay, so she wanted me to basically tell her, oh, can you go ahead and do the beds? Can you go ahead and, you know, fetch the patient a jug of water? All those kind of things. And I was basically doing everything myself. So she said that once you qualify as a nurse, you're gonna have to delegate tasks to various staff, you know, to take the burden off your shoulder, and also so that you can focus on more complex care, if that makes any sense. Going back to this reflection, firstly I will start with title. So for this title, I'm going to say dementia patient admitted on ward with previous MRSA. So we know that if a patient has had past tense MRSA, they normally have to go into an isolated area. Given this situation, the reason I want to type about it is the fact that this patient was not isolated in a side room. Reason being is firstly because she's diagnosed with dementia and she's also risk of fall. So having her in the side room would be no good to us, because she will be on the floor before you can turn your back. Normally they would put patients in the side room that are mostly independent, because we don't have to constantly keep an eye on her. However, in this case, because the patient's got dementia, she's high risk of fall, so she needs to be kept in a bay where people can actually observe her. So I would say that let's start off with patient in question has been diagnosed with CCF, has been diagnosed with congestive cardiac failure. So in brackets I'll put CCF, you know, because that's the abbreviation for it. And past MRSA as well as dementia. So that is what the patient came in with. And as the patient suffers from dementia, there has been a lot of care planning involved in regards to the patient's care. So basically, the first things first, patient in question has been diagnosed with CCA, congestive cardiac failure, excuse me, previous MRSA as well as dementia. As the patient suffers from dementia, there's a lot of care involved in regards to the patient's care. As the patient suffers from dementia, no. As the patient suffers from dementia, the patient is risk of falls, hence the patient has not been put in a side room, so we'll put that together, side room. However, other infection measures, infection prevention measures have been put in place for the staff as well as the other patients in the bay. In addition, as the patient is risk of falls, and appears to be confused, okay, extra measures such as one-to-one has been put in place for the, okay guys, don't mind my writing, I'll correct it, for the patient's safety. So that's the basic background of the patient, okay? And then also I'm going to be including, in addition, patient is able to eat independently, however requires lots of prompting with both foods as well as fluids. So that is overall the history of the patient. So I'm also going to be adding, as the patient suffers from dementia, and normally when you're doing the medication round, obviously you would ask the patient to confirm their full name as well as date of birth. However, at this point in time, as the patient suffers from dementia and is unable to confirm their full name and date of birth, it is our responsibility to ensure that the patient has the correct wristband on, you know, that will identify them as the patient that they are, in accordance, or rather in relations to the medication that we are going to be administering to them, if that makes any sense. So I'm going to add that as well, okay, because that's also part of my learning outcome. In addition, as the patient is unable to confirm their full name and date of birth, in addition, as the patient is unable to confirm their full name and date of birth, it was our responsibility to ensure that the patient is wearing the correct wristband in order to be identified correctly when administering medication. In addition, patient had to be observed and prompt to take medication correctly. Medication explained to patient. So the reason I say medication explained to patient is because even though a patient's got dementia or any sort of cognitive impairment, you still want to be explaining to the patient obviously what medication they are taking and what for. Immaterial whether they will understand or they won't understand, that is not our judgment to make. Okay, we still have a duty of care to explain to the patient what the medication they are taking is for and what are the side effects, okay, if they ask for it. But normally you would explain, okay, you know, this is what's happened. So further onwards throughout the day, the patient appears to be agitated and in distress. So in this case, guys, you really have to make an informed decision. Now what I mean by this is the patient, firstly, we know has got dementia. Okay, so the patient also, in addition to that, has got CCF, as the patient is on IV furosemide. So the patient is fully continent. So that means, you know, you need to be able to assist the patient with toileting, and also obviously because the patient is not moving, you also have a responsibility to check the patient's best shots. Where were we? So the patient appears to be agitated and in distress. Analgesia medication administered. So analgesia medication, pain medication. So paracetamol, cocodamol, codeine, those are all part of the analgesia medication. So they fall all part of that. So as the patient is agitated and distressed, the patient might be in pain. However, due to the patient having dementia, you have to really monitor the behavior to see whether they're in pain or not, because the patient is unable to communicate that. Mostly patients who are diagnosed with dementia, especially if they're reaching the further stage in dementia, they won't be able to tell you that they're in pain. You really have to be observant in regards to that. So that's also part of your learning outcomes, to monitor the patient's behavior. So anyway, so this is what happened, as appears to be in pain. Okay, I find this a very interesting reflection to write about. Now the reason for that is because most patients that we got onto the ward, cardiology ward, compos mentis, they're able to communicate all their care needs, and so there was really minimal care that you needed to give to that patient. However, if you get a patient who unfortunately is diagnosed with dementia and they have to undergo cardiology treatment, because obviously in this case the patient's got CCF, it's a different type of care that you will be giving to this patient, because you are basically the patient's advocate to a certain extent, because you have to be able to monitor the patient to see what the patient needs, because the patient is unable to communicate their needs to you, if that makes any sense. So what were you thinking or feeling? So I was thinking whether the patient's care has all been met and whether the patient is comfortable. So I was thinking about whether the patient's care has been met. Firstly, whether the patient is comfortable. Obviously you can see whether the patient is comfortable obviously through their body language. In addition, I was thinking what else can be done for the patient, as patient appears to be settled and comfortable. Okay, so that I just keep it short because you don't want to, you know, write a long story, because, you know, whatever. So evaluate whether it was a good or bad learning experience. So firstly, it was a good learning experience. It was a good experience. Okay. Firstly, because it allowed me to be able to make person-centered care decisions, person-centered care decisions based on the patient's needs. In this case, patient was unable to communicate their needs as a result of dementia. Also, it enabled me to be observant of the patient's change of needs. In addition, I learned that not all patients will be able to advocate for their own care needs. It's important to advocate for the patient. When I'm talking about advocate for the patient, I'm not talking about obviously making drastic decisions for the patient. So I'm not talking about advocating of the patient's financial needs. I'm talking mainly about advocating for the patient when they are on the ward. So like I said, when you see the patient is in pain, you give them pain medication. If you see the patient needs to go to the toilet, you take them to the toilet. If you see that the patient is breaking out in regards to pressure sores, you start implementing plans on how to prevent the breakouts from getting worse, if that makes any sense. So that's what I mean by advocating for the patient. So that is what I wrote so far. So what sense can you make out of the situation? Also, I'm going to basically copy and paste what I've already said. So basically what I'm going to say in this situation is, I learned that not all patients will be able to advocate for their own needs. Hence, it's important to educate for the patients in accordance to their care. So what else could you have done? In addition, practice correct PPE technique. So the reason I'm saying PPE technique is, as the patient is in a bay and has previous MRSA diagnosis, there's a certain way you go on with their PPE. They normally have their own gloves, their own aprons, and their own bins next to them. So you wouldn't use the same that you're using for them for the other patients, if that makes any sense. That's just to prevent it from cross-contaminating to other patients, if that makes any sense. So I would always put there, in addition, practice correct PPE technique. And then I want to add here again, all changes documented in the patient's medical note, as well as nursing evaluations. Now that is just to say that anything that happened with the patient on that specific day, you have documented it, you put it in the patient's medical notes, you put it in the communication notes, so whoever's taking over from you, they know what happened with that patient on that specific day, and also what is the plan going forward. Like I said, with the reflections, you don't really want to make it too complicated. Just get straight to the point, say what you need to say, and then, you know, move on to the next. So basically this space over here where it says discuss with mentor, I will leave that for the time when I have it with mentor. Action plan, I'm not really going to speak about the action plan, because at the end of the day I did what I needed to do for that patient. Okay, so in regards to action plan, I normally leave that open. If the mentor feels like it's something, you can always go ahead and fill it out with a pen. It's not a big issue, because these kind of documents, guys, it's your own. Basically you keep it in your folder, isn't it? So that's basically how I do my reflections. Now in regards to my learning outcomes, now we have this pad book, practice assessment documents. Okay, now with this assessment, like I said, we've got about 44 learning outcomes that we have to achieve. So in this regards, I wrote down number 10. Let's go to learning outcome number 10. So Number 10 basically talks about, understands and applies current legislation to all service users, paying special attention to the protection of vulnerable people. Vulnerable, which means the patient's got dementia, including those with complex care needs from aging, cognitive impairment. Cognitive impairment is also part of dementia, and those approaching the end of life works within the legal and ethical framework taking into account. So basically, that's part of the learning outcome because you've taken all of that. Guys, I'm not going to go over all the learning outcomes, but this is basically how you go ahead and do your nursing reflections. Obviously it varies from university to university. If you guys don't do your learning outcomes that way, that's fine, but anyway, this is how you go about writing a reflection when you're on clinical placement. So yes guys, I hope you like this kind of videos. Please let me know what other videos you would like me to do. I've got a bit of numeracy videos coming up because I've got a numeracy exam as well that's going to come up, so I would like to document that for you guys as well. I hope you guys got some sort of feel what it's like to write a nursing reflection, okay? And to be honest with you, nursing reflection is straight to the point. As long as you learn something, it shouldn't be hard to be able to write a reflection, if that makes any sense. So yes guys, this brings me to the end of my video. I really hope you like this type of video, guys. Please don't forget to comment, like and subscribe, and I will hopefully see you guys in my next video. Bye.